When people move to Cyprus, one of the most common questions I get is, how does the health system work? What kind of health insurance do I need? How much does it cost? Are the doctors good? Are the hospitals good? Do they even have hospitals in the first place? I will answer those questions and more in this video, so it's definitely going to be interesting. Hey everybody, it's Rikugo, and in this video I will talk about everything you need to know about the healthcare system here in Cyprus. When I left Germany in 2018, I first moved to Bali, and the one thing my mother was so concerned about was healthcare in Bali. What will you do if something happens? Don't worry, I know everything is covered, but obviously I had no idea. I just said that to calm her down, and I was so excited because I was going to Bali. And she doesn't speak English, so she will never find out. Anyway, the older I became, the more I realized how important proper healthcare actually is, and that is why I want everyone that comes to Cyprus to know exactly how it works here and what you will need. So, first let's talk about how the Cyprus health system works in general. In 2019, Cyprus introduced a new universal healthcare system, which is called GESY, and this is basically the Cyprus form of the national health system, the NHS, and this gives you the basic healthcare coverage. There are a lot of doctors and hospitals that are also in the GESY program, and then you can visit them with the GESY coverage completely for free, and even a lot of private doctors are also under GESY. When you are in the NHS, you can then get a European health insurance card, basically this one. And then you can also go to other countries, use it there, because the NHS program is not just in Cyprus but all over Europe, which is amazing, of course. My personal experiences with the GESY program so far is very good. I've done some general checkups here in Cyprus and they were all completely for free, and one time I even did a full blood test and I only had to pay 30 euros because I also wanted to test vitamin D, which is probably enough here in Cyprus, but this is even cheaper than what I paid in Germany for a full blood test. And they are actively adding more and more professions to the GESY program so that you can receive as many services as possible that are GESY covered. Also, my girlfriend recently had a surgery. She got her tonsils taken out and she stayed in the hospital for about 2 days, and the costs were about 2,500 euros. But GESY covered it all. She didn't pay a single cent for the surgery, for the hospital stay, not even for food or coffee. So from my own experience, the doctors here in Cyprus are very professional. They take their job very seriously, and I really love that, because some other people here in Cyprus are not like that. But I talk about this in that video. I have the feeling that Greeks in general are really passionate about medicine and health, and that is also the reason why there are so many health students and med students here in Cyprus. A lot of them study medicine here in Cyprus and then fly abroad, live in another country. Let's take Germany for example. They study there for decades, and then after some time, maybe 20 years, they come back to Cyprus because they want to be with their family, and then of course they are working here in the Cyprus hospitals, and that is the reason why we have so many experienced and very good doctors here in Cyprus. Now, something that is super interesting is that we do have these skilled doctors, but we have a very small patient list, because Cyprus is a relatively small island compared to other countries, and we have a very small population. And this means for very complex services like surgeries, for example, you will have a very short waiting list. And that is actually the reason why a lot of English people prefer to fly to Cyprus, get treated here within, let's say, 2 months, instead of waiting for 6 months for an appointment in the UK while they have an acute problem. In simple terms, Cyprus, not so many people, a lot of doctors, fast treatment. London, on the other hand, also a lot of doctors, but so many people, and that means a lot of waiting. Alright, and now about the costs for the NHS or GESY program, and that is actually all of the costs are covered by the social insurance contributions. That means for me, for example, I have 2 companies, I'm paying myself out a salary every month and I have to pay social insurance on that salary, but also I'm paying myself out dividends from time to time, and on that dividends I also have to pay 2.65% to the NHS, but because the dividends are tax-free here for me, because I'm a non-dom individual, I'm more than happy to paying for the NHS services. And that's it. There are no other additional costs, no hidden costs. With those 2 payments, I'm covered with the NHS and GESY program here in Cyprus and all over Europe. Currently I'm with a private hospital here in Paphos and I'm very happy with them. But there are a lot of other GESY covered hospitals that are cool, modern, even digital, all over Cyprus. From the outside, sometimes those hospitals here in Cyprus look a little bit different than Central European hospitals, especially the private ones. But when you're inside, you basically feel like in a normal hospital from Central Europe, from Germany, France, or wherever you are from. And a lot of them are also very digital. For example, you can download an app and then you can even make online appointments. When you are there, everything is structured, very professional, and I personally always have a very good feeling and I have very high standards. But there are also general hospitals here in Cyprus. In Paphos, for example, I think we have 2, and they are these big buildings that we are used to from Germany or Central Europe. Now, a question that I regularly get is if an additional health insurance is necessary or not. And that is definitely a good question. For me, I decided no, but I'm not you, so you need to decide for yourself. But of course, I'm helping you with that decision. And there are a few factors that come into play. And that is how often you travel, inside and outside Europe. For me, now I spend most of the time inside of Europe, so I'm basically covered. Also, I'm generally very healthy. There is nothing I have in my body, so I'm very thankful for that, but that also means I'm not visiting doctors that often. And so I decided that I don't need any extra coverage because I will most likely not use it. But if you do travel to the US, to the UK, to the UAE from time to time, and you do have some chronic illnesses, you want to go to the doctor regularly, and you want to go to the physiologist, to the psychologist, and to many other professions, then you do probably need an additional health insurance. As I said in the beginning, at the time being, the GESY program covers the basic health care. That means if I want to go to the dentist, for example, for a general checkup, I have to pay an additional 50 euros for that because I can probably survive without this dentist visit as well. I could also say now use this one specific health insurance, the link is in the video description, but I'm not going to do that because I'm not advocating such business models. But I do recommend you to do your own research, especially if you think an additional health insurance is important for you, maybe even consult with an insurance broker, but definitely beware to not pay too much. From my own experience of helping a lot of people move to Cyprus and some of them wanted an additional health insurance, I know that you can get a very premium health insurance that will cover you worldwide for about, let's say, 300 euro, and basically almost anything is covered there. And actually, if you want to become a Cyprus resident, you do need to show a health insurance, an additional one if you're not in the GESY program yet. But this can be the most basic health insurance out there, about 200 euros per year, that will only cover your transportation to your home country. When moving to Cyprus, healthcare is definitely important, but there are a few things that are even more important, and I'm talking about them right here, so I will see you there.